everybody, I'm Michelle, and this is another episode of Get Well with Michelle. I'm going to start doing that. It's going to be like my intro, the namaste. So we start off as we usually do with our quote of the day. Today's quote is, "Every problem is a gift. Without problems, we would not grow." And that was said by Anthony Robbins. Okay, so for today's topic of the day is this is something I want to talk about because I'm dealing with it personally, and I'm always looking for, helpful insight on, ways I can help myself, help the community. So today's topic is chronic pain and mental health. Sprinkle on a little addiction. And not that I've relapsed or anything, but, for me, let me just start off by saying I am a chronic pain patient. For those of you that don't know, I have degenerative disc disease, and what that is the degeneration of the spine over time. I was diagnosed when I was 25, which was really scary because usually it's a disorder or disease or whatever you want to call it that you see in older patients. And the fact that I had it when I was being diagnosed with it when I was 25 was like, oh my God, what's the rest of my life going to look like? How am I going to live my life when I'm constantly in pain? Which is something that I'm still trying to answer for myself. So I had a disectomy in 2018. So just real quick, here's a couple of pictures of me post-op of my cervical spine, lovely black eye, and a lovely Frankenstein neck. In 2018, before that, I had spinal cord stimulators put in. I had injections, trigger point injections, RF ablation, epidurals. I had a lot of the non-invasive procedures until we got to the spinal cord stimulator, which is, something they have to put on your spine, surgically. And then, but after that, no doctor wanted to touch me because of my age. So my husband, the saint that he is, he has been with me through all of this, and I love him so much. So I love you, baby. Thank you so much for being through this and getting me through my bad days and everything. So shout out to him. So it got to the point where he had to take me to India. Yeah, I'm talking about halfway across the world to get a disectomy done. And now I'm trying to remember the doctor's name. I can't remember. He's going to kill me because I can't remember. Pune. Dr. Pune. I'm so sorry. At BLK, Super Specialty Hospital. It sounds like a hospital for superheroes or ninjas or something. I don't know. Super Specialty Hospital, BLK, yeah. Okay, that'll be their intro music now. But Dr. Pune fixed me up. He took the spinal cord stimulator out, rip, and did a disectomy in my L4, L5, and C3 through C6. I can't remember I can't remember the exact disc in my neck, but something like that. I also had a reverse cervical spine. So basically my neck was not curving the way that it should. So they had to put a big old bar in there and crank my neck backwards. So that's probably why I have a lot of pain in my neck. I recently had an MRI done, and it shows further degeneration and multiple cysts on my spine. So there is probably another surgery in my future, if not multiple. So yay. Okay. But what I really wanted to talk about was how I get through the bad days. And the bad days can get really bad. And lately they've been really bad. Like, I've been to the point where I've been like in child's pose on the floor, crying my head off, like sobs down my tears. I'm an ugly crier, so face all red and splotchy. And, my husband having to calm me down. And I do take medication for it. I used to be prescribed opiates, which wasn't really great for me because I am an addict. And I became addicted to the opiates. Wonder why that happened. I became addicted to the opiates really quickly. And but it was kind of like, what was I going to do for the pain? And that's why we had to trudge our butts off to India to get the surgery, because we needed something to intervene. And right after I had the surgery, I went into, and we came home. So after a couple weeks, I went into rehab. So imagine me like walking into rehab with a big old neck brace and a back brace, like not fun. And I did get off the opiates. Yay! Been sober for almost 5 years. I do still take medication, but it's obviously not addictive medication. I take like a muscle relaxer and a nerve blocking medication to help, with the really bad like spikes in my pain. Ugh, my neck hurts so bad right now. But how do I get through the times that I'm like, why me? Why is this happening to me? And that's a really hard question to answer. And I don't think there is a good answer for it. It's just the luck of the draw. It's just something that happened. I just got dealt a raw deal, and unfortunately, this is my reality. So, for those of you that do suffer with chronic pain and the mental health that goes with it, and maybe even the addiction, all I can say is just get through it, stay strong. Drugs aren't going to solve your problem. Stay vigilant. There has to be something out there that can help. And a little bit later on, I'm going to show you some of my favorite products for that I use for like when I'm having really bad pain that are not medication. So yeah, I mean, I don't really. I wish I had the perfect answer for those of you that are dealing with this issue, but all I can say is this is not forever. That's the thing that I say to myself so many times a day. This is not permanent. This is not forever. I'm going to get through this. And if anything, this experience is making me a stronger person. It's making me who I am today. It's making me be able to come on here and talk to you guys and hopefully pass on the message that it gets better. Life gets better. And, just get to that next day. Or even if you can't even think like just for today, or say, okay, I'm just gonna get this for the day. Say, I'm gonna get through this hour, I'm gonna get through this minute, and hopefully that can stave you from getting into those deep, deep, dark circles of hell that that push you, that chronic pain can push you to be in. Hopefully it can push you to not take that drug, to not get into those patterns of grief. And, just try and stay positive. There's got to be something out there that can motivate you to push forward through this moment in time. I know it's not great answers, but I'm trying my best. You know, and I myself am still trying to answer that question for myself, because those times do get so dark and so problematic, but without the dark, there can be no light. Yesterday I had an awesome day. My pain was very moderate to low, and I haven't felt like that in a good long time. So I just really cherish those days, and I hold on to them, and I make them extra special, because I know that there's going to be the next day, or the following day is not going to be so great, because the pain is almost intolerable. I say almost, because there's a lot we can tolerate if we just push ourselves. Okay, so before I get into some of my fave pain products, I did want to just mention real quick, because I didn't say it before, that after I had my discectomy, I had about 5 years of pain relief, and it was awesome. So thank you, Dr. Pune. I did have a great experience with that surgery. I mean, the surgery was not fun by any means, very painful, but totally worth it. And I upped my physical game. I did do PT for 5 years, but now my physical therapist is saying that PT is no longer helping. Teary face. But so we're just looking at what's next in the game. Okay, so with that, my products that I use. The first one I want to show you is these. They are lidocaine pain relieving patches, and this is by Wellmate. Got it on Amazon. I go through so many of these. These are awesome. I mean, you just put the patch on like once a day, and they're super sticky. You can sleep in them. And they stay pretty much attached. Like sometimes there's a little peeling around the edges, but that's about it. So I can put one on in the evening, and it will stay on until like about the afternoon the next day, which is pretty awesome. These are 4% lidocaine, which is usually what you can get in stores. Usually you can get like 4% or 4.5% on shelves. I'm not sure. But these are great. They're maximum strength, and I love them. I love them. So yay. Run out today and get yours. Promo. Okay, this actually is a prescription. So you'd have to ask your doctor for this. And I just want to hide the actual, take that off. That's my prescription info. This is just lidocaine ointment. Oops. Yeah, okay. Lidocaine ointment. I know people out there hate the word ointment. I hate it too. Ointment. Ugh. Okay, sorry. This is 5%, and that is prescription strength. So if you have like an ortho or a spine surgeon or a pain management doctor, just ask them for some lidocaine, and you can get yours at a pharmacy. Okay. And like the maximum strength you can get on the shelves is like 4% or 4.5%, so it's not that much of a difference. Those are great products too. The next, okay, so this is a Melaleuca product. Thanks, Mom, for giving me this. I don't have a Melaleuca subscription, but she does. And this is Blue Heat. It's kind of like Icy Hot, but these are awesome. I think Icy Hot does this too, but these are just rollers, so I can just like, use it right now. I just, feels so good. Oh. This is like, I think this one's stronger than the Icy Hot. It's great. Of course, my husband says I smell like his grandmother. Thanks, babe. Okay, and my last but not least is BioFreeze. These are awesome. They also come in the roller, which I like more. This is the professional gel, which I don't understand. Like they usually come in like a green bottle, and that's like the regular one, but I don't know what's different. What's the difference between professional and the regular? Maybe it's like the percentage of the menthol that's in it. Yeah, these products are just like menthol, you know, like icy hot. But you know, they dull the pain and they work for me, so I like them. Um, that's all I have. So those are my main go-to products. I love them very much, and they work for me on a daily basis, and it's nice to um have those products and, you know, not run, you know, directly to medication, which is, you know, when you're in pain, that's like your first go-to is like, oh, I need to take something for this to dull pain, but you really don't. There are other options out there. Okay, so that's all I have for today. Like I always say, I'm not a healthcare professional. If you need professional help, please call someone in that professional neighborhood that you need help with, whether it be chronic pain, addiction, or other mental health issues. If you're in crisis, please go to the ER, call 911, call a suicide hotline, call a friend, call a parent, call a loved one, call someone, talk to someone about it. You know, people are more understanding than you know. And they really just want what's best for you and want to get you help. So please just talk to someone. Um, please like, share, comment, subscribe, all that wonderful jazz. Please share with me your knowledge of mental health, or if you think I should do a certain video on a certain topic, or if you have information for me for my chronic pain issues, like a certain procedure or injections or what or a product or whatever, please share with me. I would love to get your feedback. All right, that's all I have. Stay strong, loves.